Hey everybody. Welcome to week 9. We're a little bit over the hump in terms of weeks. Really excited. So today we have our climate change talk. I hope y'all are all excited. I'm so excited. I hope you've all watched the documentary and got a lot out of it. As someone who's made a documentary themselves, I always love to watch documentaries. It is one of my favorite genres. So we're going to start with our intro, and then I'm just going to let our speaker take it away. Let me share my screen. Give me a moment. There's no sound to share. This is not every week. Okay. So welcome to Epidemics of Injustice. The theme of this year is co-disruption for collective liberation in public health. Please introduce yourself in the chat with your name and your pronouns. Please complete the check-in form. There's a QR code you can scan here. If you go to our Google site, you will also see that if you need to scan it from there. During the presentation, please put any questions or comments you have in the chat, and there will be time for questions at the end. Okay, so here is how to use the Zoom controls. Please keep it on mute so that we can clearly hear the speaker. If you do want to start your video, you can. It is not required. And if you want to check the chat, when you do your introduction or to speak and respond to someone, you can also click the chat function. All of those are available in the lower bar. We are the teaching instruction team. So there's Katie, Nandini, and myself, Washika. So about the course, this annual course is free and open to the public, and it prepares public health leaders and community members with the tools to bring about social change and address structural determinants of health. All course meetings will take place virtually. This course is open to students and the public from 5:30 to 6:30 CST, and students taking the course for credit stay from 6:30 to 7:30 for a closed discussion. Epidemics of Injustice is sponsored by the Collaboratory for Health Justice at the USC School of Public Health. And we would also like to thank Radical Public Health for the creation, support, and promotion of this program. RPH is celebrating its 11th year. And so for more information about RPH, please visit their Facebook page at facebook.com//Radical Public Health. So please know with the content warning, today's lecture contains materials that might be difficult to discuss. Please step away if you need to take care of yourself during the presentation. We would also like to do our weekly land acknowledgement. The Collaboratory for Health Justice acknowledges that the University of Illinois Chicago resides on the traditional territories of the three Fire peoples, the Ojibwe, the Ottawa, and the Potawatomi. Purchased after 2.5 years of open warfare, decades of violent encroachment, and the defeat of a pan-Indian movement to keep settlers out of the Great Lakes region at the Treaty of Chicago in 1821, receiving their final payment before moving westward in 1835. The area was also a site of trade, gathering, and healing for more than a dozen other Native tribes. The state of Illinois is currently home to more than 75,000 tribal members, and the Chicagoland area is currently home to one of the largest and most diverse urban Native communities in the U.S. Illinois is also the territory of the Ho-Chunk, Miami, Anoka, Menominee, Sac, Fox, and their descendants. By making a land acknowledgement, we recognize that Indigenous peoples are the traditional stewards of the land that we now occupy, living here long before Chicago was a city and still thriving here today. As we work, live, and play on these territories, we must ask what we can do to right the historic wrongs of colonialization, state violence, and support Indigenous community struggle for self-determination and sovereignty. So here are the community guidelines. Please show up on time and come prepared. Please let everyone participate. Listen with an open mind. Have mutual respect and appreciation for one another, and respect the privacy and personal information shared during class. So this week's topic is climate change, and we have Miss Elena Grossman, and I will read her bio, and then we will get started. So Elena Grossman is a research specialist at the University of Illinois at Chicago School of Public Health. In this role, she's the program director for the Climate and Health Institute at the School of Public Health, an EPA environmental education grant to increase knowledge and awareness on climate change, health, and equity, and capacity to address it among future public health professionals, municipal leaders, and community members. Ms. Grossman is also serving as the Deputy Director of the Great Lakes Farm Worker Health and Wellbeing Center and coordinating the Region 5 Pediatric Environmental Health Service Units, Environmental Justice, and PFAS, working by making environmental health education opportunities available for healthcare providers and communities. She is also the instructor for the Climate Adaptation for Human Health course for the Yale Climate Change and Health certificate program. She served as the program director for the Building Resilience Against Climate Change Effects in Illinois, BRACE-Illinois project, which was a partnership between the University of Illinois at Chicago School of Public Health and the Illinois Department of Public Health to help prepare Illinois for the health effects from climate change. She was a Peace Corps volunteer in Guatemala, receiving her BA from Franklin and Marshall College, her MPH from the University of Chicago at Illinois School of Public Health, and enjoys doing anything outside and dancing parties in the kitchen. You'll love to see it. All right, so please welcome Miss Elena Grossman.
Hi, everyone. Let me just pull up my slides. And there we go. All right, I'm so happy to be here with you all. Okay. And I'm going to do a whirlwind tour of all things public health related to climate change at the global, national, and state level. So here we go. I always like to first start with Grover doing his near-far routine, because we have a really hard time as humans connecting with what feels far away. Think about if someone asks you, where do you see yourself in 5 years, right? That classic interview question, or even, what do you think you're going to do next year? That can feel really hard to answer, because even a year later or 5 years can feel really far away. So now when we think about projected climate in the year 2100, it's really hard to connect with that. That's what you're looking at right now. It's a map showing future changes in heavy precipitation events. So how likely will we see more heavy precipitation events in the year 2100 based on greenhouse gas emissions that have reduced, which is on your left, and greenhouse gas emissions that continue to increase on your right? But either way, it's in the year 2100, and it's really hard to connect with that. But what we do connect with are events that have happened particularly close to home. So you're looking at different flooding events that have happened throughout the state of Illinois in the last 10 years. We can see them, we can sympathize with them, we might be able to empathize. There's research that says that the closer the disaster, the more likely you're able to relate to it and it resonates with you. But even when we see destroyed homes from wildfires in California, we can understand how it might feel to lose your home, to be displaced, and all of the physical and mental health challenges that come with that. And there's data to support this. So Yale has a program on climate change communication, and they conduct surveys almost once a year. And there are a whole number of questions on how people in the United States perceive climate change. And so I've pulled two. The one on your left shows that almost 3/4 of people in the US think that climate change is happening. But the one on your right shows that less than half think it's harming them personally. And this is really critical when thinking about advocating for policies to address climate change. So we might not be likely to advocate for something that we don't think is harming us personally, right? So why would we do that as much as for something like climate change that you don't think is harming you, as opposed to something that you think is harming you? So this, I think, is really critical, and where we need to shift the conversation that's away from polar bears and glaciers, which have been very common, and while important, people don't necessarily connect with it as much, and to humans in health, which is what I say here, right? So going from polar bears and glaciers to humans in health. Really quickly, we are going to do quick climate science, why it's happening, right? So this kind of goes back to science class in, I think it's like 6th grade or 8th grade. So we need greenhouse gases to help allow Earth to be warm enough for us to survive. And there are these natural greenhouse gases that happen in the atmosphere, and they help trap the heat from the sun. The problem is that there are more greenhouse gases than ever before, trapping too much heat. That's exactly what the issue is. So where are these greenhouse gases coming from? This is looking, excuse me, this is looking at greenhouse gas emissions by sector. You can see that the biggest source is energy supply. So where we get our energy, right? Whether it's coal, whether it's natural gas, whether it's wind, solar, right now, energy supply is the biggest source of greenhouse gas emissions. That was a global level. This is looking at greenhouse gas emissions by sector within the United States. So on your left, it's showing the different types of greenhouse gases, right? So probably hear the most about carbon dioxide. As you can see, that is the biggest contributor of all greenhouse gases is carbon dioxide. So whenever you hear, we need to reduce carbon dioxide emissions, this is why. It's the biggest chunk of the pie of the types of greenhouse gases. And on the right, it's showing where these greenhouse gases are coming from by sector. And you can see transportation and electric power, but transportation is really the biggest. This is, you think about in the United States, how we get around, right? We primarily get around by car. We don't have the best public transportation, especially trains for long distance as other countries have. So then if we look at carbon dioxide, just that one greenhouse gas emissions over time by region, you can see that North America and Europe are the biggest contributors, and many of the countries from low-income countries are the lowest. And you'll see that pattern, right? The people who have the fewest resources, have the least amount of power, have been historically underinvested, often are most impacted by climate change, but contribute the least to climate change. So a little bit of climate science, a little bit more. How do we know climate change is happening? Well, climate scientists use these 10 indicators that you see in this infographic, and every single one of these indicators is happening. So it's a really clear indication that climate change is happening. And this is showing the direct relationship between carbon dioxide and temperature. So just a little explanation of this graph, this horizontal line right here is the average temperature from 1880 to about 2010. And then each bar represents the annual temperature for that year relative to this average temperature. Now, the black line shows the level of carbon dioxide concentration in the atmosphere over time. And you can see that as the concentration of carbon dioxide is increasing, temperatures are increasing. I didn't give you a ton of facts and science, but I did give you some. And this is Leslie Knope, one of my favorite characters from one of my favorite shows, Parks and Recreation. And she said during one episode, all I have on my side is facts and science, and people hate facts and science. This was actually from an episode when they wanted to put fluoride in the Pawnee drinking system. And it's true, right? Facts and science are important. They're important for planning. They're important for thinking about the future. They're important for thinking about existing projects. But when talking to people, people don't resonate with facts and science, right? People resonate with stories, with people, what they can see, what they can maybe even touch, and what they can feel. And really important point, just in thinking about when you might have conversations about topics like climate change that, while shouldn't be political, are, and how to best talk about it. But I am going to continue to share facts and science with you. I just wanted to share that point. I think it's a really important takeaway when you're talking to people. So what you're looking at is basically an overall slide showing how in the middle, you see that ring spinning. That's the root cause, right? We have rising levels of carbon dioxide that's leading to rising temperatures, rising sea levels, and that's leading to a number of environmental conditions that are changing. We have more frequent and severe heat waves, more frequent and severe extreme weather, worsening air quality, worsening water quality, changes in vector ecology. And all of these environmental changes have big public health impacts. As you can see, there's a number of them. What's important to point out is that, first of all, none of these impacts are new, right? They're all existing, but climate change will exacerbate them. It just makes them all worse. The other important point is that it's all about climate change increases the risk. It's all about risk, right? So it makes these impacts worse. It also increases the likelihood of getting one. And then finally, not all of these impacts are relevant to every part of the world, right? Cholera, for example, might not be as relevant in the United States as it is in other countries that don't have potable water or water systems to help clean water. Malaria, for example, might not be relevant to Canada, but is more relevant to South Africa or Uganda. And we're going to talk about how each of these health effects are impacted by climate change. So before we jump into going into each health impact, I just wanted to share this research that shows just overall mortality risk from climate change across the world. So what you're looking at are two different maps, and it's all, this is modeling, right? So an important difference, I'm going to share climate data that talks about trends, and so that's existing weather that they look back into back in the past, and how has the weather changed over the time. And then there's projections. What will it be like? And that's all modeled, right? It's not perfect. You can't say 100% this is going to happen. Just like when a meteorologist or Tom Skilling, for example, says, you know, we're going to have a snowstorm like last weekend, and we didn't get a single drop of snow, right? It's not perfect, but it can definitely help guide us. So there are two different maps that you see. The one on the left is based on if we reduce our greenhouse gas emissions. We still have too many greenhouse gases in the atmosphere, right? So there's going to be an impact, but we can reduce it to reduce the impact. And the one on the right is if we just keep increasing. And so what it's showing is mortality risk of climate change overall, right? Any types of climate change risk. The blue is showing a decreased, and as you get more red, it's showing more of a higher risk. And so you can see that especially in Northern and Central Africa, that's like the hot area where you're seeing a higher risk, as well as parts of Southeast Asia. Again, many countries, except for maybe India, many of these countries are contributing the least to climate change, but obviously have some of the worst outcomes. So first, we're going to start with heat. Now, the image that you're looking at, you might remember from the documentary. This is from the '95 Chicago heat wave. As you heard, there were over 700 people that died. This image is a mass grave that they had to dig in Homewood, Illinois, because the Cook County Coroner's Office had so many unclaimed bodies that they had to dig up a mass grave, right? You don't think of a mass grave happening in a country that is not at war, and B, as a result of a heat wave. So that's how big this heat wave is. It is still the biggest killer, the most fatal of all heat waves in the United States. So how is this related to climate change, right? This is the most direct relationship. What you're looking at is observed US temperature change. So this is what I was talking about. This is looking at trends from the past. This is from the National Climate Assessment. It's a great resource. The government, US government, actually requires what's called the US Global Change Research Program to develop the National Climate Assessment every 4 years. It looks at trends for over time. It provides projected data, and then it looks at how climate change is impacting a number of sectors. It is made up of, I always forget if it's 13 or 16 federal agencies, so it's an amazing resource. And so this is looking at the difference between the average from 1986 to 2016 and the average from 1901 to 1960, right? Most of the country, we're seeing rising temperatures. I want to particularly point out winter temperatures, much warmer. And this actually has a big impact on our health. So sticking with heat, this is just another graph showing that we've had more record highs than record lows over time. So what you're looking at, on the x-axis, right, along the horizontal line is over time. And then on the y-axis, it's a ratio of daily temperature record lows compared to record highs. So if you see a red bar, right, that means that there were more record highs compared to record lows, and blue is more record lows than highs. Now we go towards the end of this time period, right? Starting in like the late 90s, you start seeing way more daily record highs than record lows. And when we talk about heat stress illness, we're talking about a spectrum, right? We're starting with heat rash, heat cramps. Many of you may have experienced those. I have. Moving into heat exhaustion and heat syncope. Heat syncope simply means fainting, and then heat stroke, which is the most fatal. And basically what happens is your body is not able to cool down anymore, and there can be multiple organ failure. There was a study looking at deaths related to extreme temperature, extreme cold and hot. Now, if you look at the top and you see all these little figures, these people figures, cold means cold related deaths, and red means hot. Now there have been more cold, right? Here's the number, almost 5 million versus almost 500,000 heat. But the interesting point is that, this is over a 20-year time period. In the last couple years of this, so like 2017 to 2019, the number of people dying related to cold has decreased, while the number related to heat has increased, right? And then you can see globally, where are we seeing most of these deaths? And most of them are happening in Asia and Africa. And it's also important to point out that heat is the most fatal of all weather-related fatalities in the United States. So this is from the National Weather Service, and it's showing fatalities from different extreme weather events. The red bar is just for the year 2021. The blue bar is a 10-year average. The yellow bar is a 30-year average. When you look at heat right here, it's the highest in all three categories. You can't see heat like you can see a hurricane, a flood, a wildfire. It's a silent killer, but it's the most deadly. And it is entirely preventable. Nobody should get a heat-related illness. The other health impacts we're going to talk about, yes, it can happen, but heat, nobody should get it. It's a really important point, and there's a really big equity component to it. So moving on to extreme weather. This is actually an image from the floods in Pakistan from this past summer, which were some of the most, it was, I think, the most fatal of all flood events that have happened in Pakistan. So when we talk about extreme weather, we're talking about floods, hurricanes, typhoons, and wildfires. If we look at climate change data and how it's connected, right? So this is also from the National Climate Assessment, looking at the United States. It's looking at the changes, the average from 1986 to 2015 minus the average from 1901 to 1960. It's a percent change. Again, if we look at the seasons, right, we look at spring, especially fall, much wetter in the northern plains, in the Midwest, in the Northeast, and the Southeast, except for Florida, right? Drier in the Pacific Northwest and the Southwest. And also we're seeing much more heavy precipitation. There are different ways to define heavy precipitation. I want to direct you to the bottom left corner map where it says number of 5-year 2-day events. So what that means is it's an event, it's a 2-day event that typically would happen every 5 years, right? So it's a really big event because it only would happen every 5 years. We look at the Midwest, there's a 63% increase in the number of these events from 1901 to 2016. Now, the temperature of oceans impacts hurricanes. It doesn't necessarily cause more hurricanes, but it makes them stronger, right? Heat is energy. So when a hurricane is going over hot water, it gains energy. And so this is showing the trend of the temperature of the Atlantic Ocean. And you can see this rising in temperatures of the Atlantic Ocean. In terms of wildfires, now this is obviously international in the sense, like any country or land that's touching the Atlantic. This is for the United States in terms of wildfires. The only reason, so you're looking at 2 different data sources. The Forest Service is orange and the National Interagency Fire Center is teal. And the Forest Service, it's just that they stopped collecting consistent data, and that's why it kind of ends in the late 90s. But this is looking at annual wildfire burned area in millions of acres. And again, you can see that trend line of increasing. So what are the public health implications from extreme weather? Respiratory health issues, whether it's a wildfire or a flood or hurricane, right? Mold from water, particulate matter from wildfires. Increased risk of waterborne diseases. That's as a result of floods and hurricanes where sewage can contaminate our drinking water. Increased risk of injuries and death, both in preparing for an event, during the actual event, and then after and during cleanup. There can be lots of property damage, right? And the mental health impacts. I'm actually going to talk about mental health separately. But then finally, increased risk of conflicts and violence, which I will talk about. So in terms of waterborne diseases, this is looking at waterborne disease outbreaks in the United States from 1948 to 1994. The dot represents a waterborne disease outbreak. The circle represents an extreme precipitation event. Where there is a dot that is circled, that means that there was an extreme precipitation event that happened before the outbreak. And they found that almost 70% of all waterborne disease outbreaks that happen in the United States happen after an extreme precipitation event, because drinking water can be contaminated by sewage, especially. Displacement is another issue. This kind of goes with all of the extreme weather events. I want to point to 2 points on this infographic. One is here. More than 3 million people in low-income countries have been newly displaced by extreme weather disasters just in 2017. And then down here, between, I think this is between 2000, this is over, in the long term, they're saying that 280 million people could lose their land, right? Because it will be underwater in the future. So lots of displacement is a huge issue, which brings us to this idea of climate refugees. So there's an island nation in the Pacific Ocean by the name of Kiribati. And in 2014, they purchased 6,000 acres of land in Fiji because they are preparing for the fact that all of their islands that make up their country will be underwater. And so they are planning a move. This is just an image on Kiribati during a flooded event. This does not necessarily mean that it was an extreme precipitation event. It could just be high tide now, right? Because there's sea levels are rising. This also happens in Miami. They call it sunny day floods, where it's just high tide and now it floods roads in Miami. So we're not just talking about extreme precipitation events. The reason why I have climate refugees legal status is that, is that, you know, according to the UN, there are legal status. There's a legal status for different types of refugees, right? Political, social, religious. Somebody tried to actually claim climate change as a refugee status. I believe they were trying to enter Australia and they were denied. But is that potentially a future status? We don't know. And then finally, conflict, right? So there's a lot of research that shows that rising temperatures lead to more violence, both interpersonal and intrapersonal. And basically climate change is a threat multiplier. The image on your left is from an image from the civil war in Syria. There are many causes to that civil war. Some have pointed to the fact that there was an ongoing drought between 2006 to 2011 that led to a lot of people moving into the capital. And there were more people. There was a lot of unemployment in an urban area, and it just kind of added to the mix of leading to their civil war. Now, the image on the right is in Kenya, and this was a drought from 2016 to 2017, and you can see cattle that just died. There were a number of subsistence farmers who wanted to allow their cattle to graze, but they didn't have land, and so they tried to go onto private land, and violence ensued. So you can see how climate change can contribute to conflict. So moving to respiratory health, this is Dorothy Hamill. She suffers from sarcoidosis, which is a chronic disease that attacks different organs. They don't know what causes it. She follows the air quality index, which is a rainbow to let you know what the air quality is like. Green means the best, yellow, orange, red, purple. Even on yellow days, she has to adjust her activities because it can impact her ability to breathe. And air pollution remains a major danger to the health of both children and adults. Asthma attacks, it can lead to wheezing and shortness of breath, just a number of terrible impacts, right? And the WHO actually estimates that 4.2 million people die around the world due to ambient air pollution. And this is just looking at where there are more deaths across the world. And you can see, you know, the United States lights up, Brazil, and Russia. Now let's think about disease prevalence, right? So if you have asthma, then climate change is going to exacerbate it. So this is looking at a national prevalence across the world. United States and Canada really light up, several countries in Central Africa and Scandinavian countries. This is important for planning purposes to know what the existing disease prevalence is. In the United States, right, we can look at who has asthma by age, by sex, by race. There's a disproportionate percentage of people of color that have asthma compared to the percent that they make up of the population. So they're disproportionately impacted. Again, important to know when planning for climate change. So how is climate change impacting air quality? One, it's leading to an increase in allergens. 2, higher concentration of ozone pollution. And 3, increase in particulate matter from wildfires. And I'm going to briefly go into more detail. So asthma and allergies, why is it worsening? Basically, we have warmer winters, we have earlier springs, we have longer falls, which means pollen producing plants can prosper. They last longer. The graphic that you're looking at is also from the National Climate Assessment, and it's showing a change in length of pollen season between 1995 and 2015. So if we use like southern Wisconsin as a proxy for northern Illinois, we can see that over that 20-year time period, pollen season increased by 15 days. Ozone pollution is a chemical reaction of nitrogen oxide, volatile organic compounds, basically pollution from cars and factories, along with heat and sunlight. And the key variable for that equation when it comes to climate change is heat. More heat means higher concentration of ozone pollution. And ozone pollution is terrible for anybody who has healthy lungs, but worse for those with any sort of respiratory health condition. Moving on to vector-borne diseases. This is a lovely image of ticks that Kendall County Health Department, which is just 50 miles south of here, found in late February in 2018. So it was a super warm. There were a couple days where it was super warm. When it's super warm in Northern Illinois, we go outside and we go outside in our shorts and our tank tops. It's like summer when it's like 50 degrees in late February. And Kendall County, we were working with them and they thought, you know what? People are probably going to forest preserves right now. So they did a tick drag and they found 30 deer ticks. In late February, that is very rare, right? We're going to talk about this expanding season. So how is climate change related to ticks and mosquitoes? This is the most complicated connection because climate change is just one factor. There's also land use, there's also life cycle of the mosquito, and there's globalization. West Nile virus came to this country because a mosquito hitched a ride on a boat carrying tires from Asia, and it was able to live here. And that's how we got West Nile virus. Now, there are multiple components to how the distribution of these diseases are happening. But really, it's about longer falls, warmer winters, earlier springs, warmer summers. There's a longer biting season, right? So we just have this increased risk. And vectors are able to live in places they couldn't live before because of warming temperatures. So this is looking at the mosquito that carries malaria. And this is, again, looking at into the future. So it's modeling, and it's based on, if we continue based on high greenhouse gas emissions. And the yellow is where mosquitoes currently are, and the red is where they could go to, right? So you see southern United States, southern Mexico, parts of Brazil, into Asia. So you can see how they can live in other places. And in the United States, we're seeing this. This is looking at Lyme disease cases. In 1996, you can see that, it's really in the mid-Atlantic. You can almost count how many cases are in Illinois. But by 2018, it went north, south, and west, and you can't count the cases in Illinois anymore.
Just wanted to give you a 5-minute heads up.
Okay. So, we can see the trend. There are more cases in Illinois happening over time. And we're seeing the Gulf Coast tick, right? Gulf Coast implies it's from Gulf Coast, the Gulf Coast. But we are seeing it in Illinois and the diseases that they carry. I'm going to quickly go through food quantity and quality. This is really relevant to low-income countries and subsistent farmers. Climate change is impacting of food safety, both distributing food, right? So there's disruption because of extreme weather events, but also heat is leading to a higher risk of foodborne diseases. It's also impacting our nutrition. This is really exposure to carbon dioxide explicitly. So they found in labs, not in like the real world, that protein content in wheat flour decreased with more exposure to carbon dioxide, and then a number of minerals decreased in barley, rice, wheat, and potatoes. The growing season is changing. They're changing crop yields. There's changing of crops being grown in different parts of the country, which is what you see here, right? So crop yields are decreasing with red and orange and increasing in green. So crops are going to be grown in different places. And then there are more pests. And then finally, food insecurity. There's the countries. So this is showing percent of population undernourished. The bigger the person, the higher the percentage. And then they created a hunger and climate vulnerability index. Darker red, more vulnerable. So the countries that have higher percentage of undernourishment are also most vulnerable to hunger and climate vulnerability. And then again, looking at agricultural yield. Red means fewer, green means more. The countries that are most vulnerable with more hunger are also going to have a drop in agricultural yields. I'm going to quickly go through mental health because I think it's really important. But basically, all the extreme weather events has an impact, right? If you go through that, that can cause depression, anxiety, but also this idea of eco-anxiety. Like, even thinking about all of this can be stressful. And I just want to end with a study that they did after Hurricane Katrina, where they looked at people who were impacted, almost 1,000, 5 to 8 months after Katrina, right? Looking at different mental health conditions, and then a year. Now, if you look at all of these percentages, they increased over time because mental health can become chronic, to the point where 12 years, this is in 2017, after Hurricane Katrina, mental health providers were still seeing people with cognitive disabilities. They coined the term Katrina brain. So this is just kind of a summary of everything that I just said, but I'm not even going to read it because I'm going to allow time for questions.
Hello? Oh, yeah, I think y'all can see me. You just have to stop the share. You don't have to stop the share. All right. So our first question. Okay. So we'll go through the discussion board questions and then the chat questions. So the first one is, and we'll put the questions in the chat as well, don't worry. While the impacts of climate change, i.e. flooding, heat, hurricanes, fire, are considered to be major disasters, how can we approach both climate change and social health inequities as slow-moving disasters that require ongoing investment in order to lead effective prevention and ultimately save lives?
So yeah, that's a really important question. And I think, I didn't talk about climate adaptation and climate mitigation. So climate adaptation is, it's happening and we need to mitigate the impacts, reduce the impacts. Whereas climate mitigation is we need to slow down climate change and reduce greenhouse gases. And so we need to do both, right? And I think, kind of to get at the slow moving, that's more of the climate change mitigation. I didn't talk about any of the strategies, which, I probably left you feeling like doom and gloom, because there are really awesome strategies that overlap with urban planning, especially, and they have so many amazing positive impacts on respiratory health, on cardiovascular health, on mental health, social connectedness, all of the green space, all of the built environment strategies that you might hear about in other public health classes have a huge impact on climate change, because not only do trees and parks and any vegetation, plants, native flowers, not only do they help prevent heat, right? They can provide shade, they can reduce the temperature, especially in urban areas. They can also help absorb floodwater, but they can also absorb carbon dioxide, right? To help slow down climate change and have a number of positive health impacts that I just listed. So I think, it's kind of like, I always think of like the different movements, like the AIDS ACT UP movement, civil rights movement, the suffrage. Like, you had the people who were very loud and like in your face, and we need to do something about this right now. And you also had people who sat down at the table and thought about the policies, and you kind of need both. And I think especially with the climate mitigation, right, that needs to come at high level. Illinois, in I think it was 2020, passed CEJA, which is the Climate and Equitable Jobs Act, I think is the right name of it. But it actually addresses a lot of equity issues, and it aims to have energy sources in Illinois to be 100% renewable by 2050. Those are the types of policies that we need. Obviously, you have to implement them too, but that's kind of, I think that's the important piece to the slow moving health effects of climate change.
Yeah. All right. The next question is, It is clear that initiatives like the Paris Agreement on climate change have done little to motivate companies to change their way of industry so that it is less wasteful or produces less carbon emissions. Is there a more aggressive approach we can take so that these changes can be seen more rapidly?
Yeah, so I didn't go into the Paris Agreement. The challenge, I think, with the Paris Agreement is that it's an international agreement, but there's no legal binding real at the there's no, excuse me, there isn't a legally binding like agents or like ability at the international level. So that has to be done at the country level. And, you know, they can say like, yes, we all agree to this, but then every country has to go back and say, okay, we're going to actually do this. So in terms of being more aggressive, it has to be within the country. You know, it's interesting. There are companies that are doing it on their own because they're getting feedback from their consumers, right? You know, oil and gas is different because their product is different than like, say, you know, I was going to say Patagonia, but they're like a model of all corporations. So it would definitely have to, it's, you know, it's a hard, in this country, you know, is there much regulation on corporations? Not a lot. It's like not part of our culture. It's not to say that we shouldn't fight for it, but it's definitely harder in this country than say some other countries where they are culturally able to pass those policies. But it definitely has to be, I think, at the country or state level. And I will say the local level, they're also doing some really awesome work. And sometimes, you know, it might be the boil up, right? Like you start local, similar to smoking bans, right? That actually started at the city level. And then it became state and country. I remember I'm from Columbus, Ohio, and there's a city, Grandview, which is, you know, right on the border of Columbus. And Columbus was saying we need to ban smoking in all places. And everybody was saying, oh, but now they're just going to cross the street and go to Grandview. That didn't happen, right? So it might happen where it's like locally, there are ordinances, there are changes, and then it kind of boils up.
Trying to look at the last one. What are some strategies to help mitigate this gap in the public health sector? Would this include the use of community health workers to help educate on the current situation and relay these voices to the major decision makers? Or is it a broader issue that must be addressed from the top down with the hopes of this positive change trickling down to the most vulnerable populations?
You know, again, I think the best way is going to be is, you know, it's grassroots and then it goes up. I really think that the local level, there's a lot of awesome work happening at different municipalities. In Southeast Florida, right? Like their governor is obviously not very interested in climate change, but there are so many municipalities in Southeast Florida that are doing something about climate change that eventually I think it really will boil up, and that there will be models that the local level is where they're going to be providing examples to the state and then maybe even national. And, you know, in terms of getting the message out there, it's having conversations and being able to talk about it and, you know, not always just like finding common ground. You know, there was research looking at out of George Mason University where they created like the 6 Americas within climate change. And so it's a spectrum. On one end, it's, you know, it's all a hoax. And on the other end, we're all going to die. And they basically found that most people are somewhere in the middle. And so you can actually have a conversation. And so I think it's going to, you know, take like having more and more conversations with your neighbors, with, and like public health leaders, public health professionals can be leaders in this. And, you know, medical providers are trusted. You know, even after COVID-19, there's still data that finds that medical providers, like a whole range, public health professionals, there's a range, right? They are trusted by the public. And I think that's really important. They can be key messengers.
Thanks. I'm just making sure like we read them in order. But yeah, I think that that's really good. And I agree. I also see So yeah, I just wanted to do one last one from the discussion board, and then we're going to go to the ones from the chat. In those places where survival is hard, how can you get them to care about climate change and its relation to health?
That is an excellent question, right? Like there are people that fear, A, they might not be able to get a meal. B, they might not feel safe in their community. And, how do you get them to care? You can't force them, right? I think it's having it's listening. I always think of, I was at a conference and someone was talking about a project that they did in North Carolina where they got a grant to install smart thermostats in people's homes. And so when they started to do this outreach, which would help, it helps reduce energy use, but it also helps save money, right?
Yeah.
But when they started talking about it, the community wasn't interested in that. They were interested in food access. Like that was like their concern. And so the project smartly realized, you know what? We need to take a step back and work with the community and what they're interested in. And so they did that first, right? And then you build relationships and you have conversations, and maybe there's more concern. So I think it's listening to the community and taking a step back if need be, because there are lots of problems, right, that we need to address. Climate change is one.
Yeah. I think that's I think that's a really great answer. So it says, will Kiribati and other countries in a similar situation continue to exist legally and politically? Or are these countries, will Kiribati and other countries in a similar situation continue to exist legally and political, or are these countries effectively extinct once everyone physically moves?
That is an excellent question that I'm not sure I know the answer to. And I don't even know if they'll know the answer to. What I don't know, when they purchased land in Fiji, whether that meant that they become citizens of Fiji or if that land becomes Kiribati. I don't know the answer to that. I don't know if they figured it out. Maybe they have. That's a really excellent and really interesting question.
Yeah. I mean, wow.
And complicated.
It is. It's politically and sovereignty. There was actually a book called, Judith Butler wrote it. I think it's Frames of War, that talks about one of the things that makes a country is other countries' willingness to defend it and recognize its sovereignty. Because there's a ton of micronations or countries that were supposed to become countries. So I think that's an awesome kind of look at what that, in that frame, what'll happen. Or
what does that mean in terms of their the services and rights that they get? Right? Are you a member? Are you a citizen, or are you a refugee? Are you on a visa? What does it mean? And I don't know the answer to that.
The Inflation Reduction Act is supposed to direct $370 billion towards advancing renewable energy and reducing greenhouse gas emissions to fight climate change. What can we do to seize this historic moment?
Ooh, good question. What can we do to seize this historic moment? I mean, honestly, right, the biggest change happens at the policy level. It's time to reach out to our representatives and keep the momentum going. I think that is one of the biggest impacts that we can do. And we've done this and we could do more. And trying to push representatives to do more around this and make sure that it doesn't go away if there's a new administration, and how I think it's really the time to push our representatives.
Yeah. So this is the last question. What work do you see being done that makes you feel hopeful for the future? So I know you said you didn't really get to that part, but now I guess this is a bit of a time that you can kind of elaborate on what you're seeing that is making you hopeful, and things that we, as global citizens and citizens in where we live, because not everyone's in Chicago, can participate in, potentially participate in and join in on, as co-disruptors and wanting to lead these liberatory movements, or wanting to participate and join these liberatory movements.
Yeah, that is an awesome question. So One thing where I find hope, I briefly mentioned, but I think about the past movements, right? As I mentioned, civil rights, suffrage, ACT UP. Are we perfect as a result of that? No. Is there still work to do? Yes. But they were able to succeed in many ways. And so I see this as another movement where, I think we will be able to succeed, and history will reflect on that. And I find hope in thinking about the past in terms of that. Two, I think about COVID, right? So people will say, we can't make all of these drastic changes that we need to do for climate change. But look what we did during COVID. Was it perfect? No. Was it hard? Yeah, but we did it. And, I think that there's a lot of hope in thinking about that. We can do this. And then finally, all of the different, there's so many awesome strategies. Like I mentioned, some of the built environment strategies that are pretty local. If you can be a part of tree planting activities, right? That there are individual things that we can do that while we need big policy change, there are a lot of people that feel a lot of dread, obviously, right? This is it can feel really terrible. But some individuals need wait, I can actually do something. I'm part of the solution. And now I'm going to reach out to my representative and actually say something. So I think those little things like using energy efficient light bulbs, ComEd, if you're in most of Illinois, but then also I think I'm blanking on the other utility, but the other one that's in Southern Illinois, they provide free energy audits to homes, to apartments. They will come to your house, they'll come to your apartment, and they will say, this is what you need to do, this is what you can do. They will give you free energy efficient light bulbs, free energy efficient power strips, right? Small, but still something. There are, I think there's it's the Moms for Air Quality, or Moms for Better Air Quality. It's a movement. They're super active. They're a really great organization that can, that you can become involved with around air quality. There are really innovative ideas of thinking about parks. So the Netherlands have done this. New York City is looking to do this. So they build parks that are designed to be water retentions. So they design it so that rainwater flows into it, and so it can help mitigate flood water. But when it's pretty out, it's a park, right? So they're we can be creative, and I think we need to be creative in thinking about all of the solutions that we can actually do. So I think, I see hope. And then I think of again, the local level, right? The local level is where it's at. That's where they're getting the work done. That's where they can change zoning codes, right? And that's really impactful. That's at the local level. Whether it's you're required to build a tree canopy, Mr. or Miss Development person, if you want to build that, you have to include this amount of tree canopy. Or it could be you have to include California, some counties and have done this where you have to include X amount of EV stations, electric vehicle stations, stuff like that. So I think the local level also gives me hope.
Same. I, as someone who really is into grassroots and listening to community needs, because I also think the answer is so much more complicated. It's not everything's going to work for every country, right? Not every country is going to have the need or the kind of public want for certain things, or even certain solutions may work in one type of country with one type of climate, one type of geography, but that's not going to work in other climate countries' geographies either. So I think that that's really good, that if you're in the local level, you have a more intimate understanding of what is going on, right? You're more connected, you're in a community together. So I think that that's really great. So thank you so much. We were so happy to have you here. I'm really glad that you really were able to share all your knowledge with us and really kind of give us really information that was, it's really even impactful for me and the work that I do and the work we're all really trying to do to make things better for people. So again, I'd like to give a round of applause. We're going to put a whole bunch of applause in the chat. So let me just stop the recording.